Hi, my name is Kristin Williams, and I'm a senior instructor for LYT Yoga. Today, we're going to be talking about upper extremity nerve glides. And so we have a set of nerves called the brachial plexus that come from the neck down through the upper arm into the upper extremity. And there are specifically three nerves below the elbow that we will be addressing called the radial nerve, the median nerve, and the ulnar nerve. And so it's not uncommon for us to get some nerve entrapment, whether it's up at the spine with a disc herniation or bulge or a bone spur, or further down the chain at the elbow, at the wrist. You think of carpal tunnel. These are common injuries. And so a lot of times, if we just get the nerve flossing, meaning moving through its path along the upper extremity, we can get the blood flowing to it and help to unhook any areas that might be catching. Now you have to be careful with any type of nerve glide that you're not pulling on the nerve, especially if it's irritated, because that can only make things worse. So I would always recommend going to see your physical therapist or your medical health professional if you're having significant issues. But these are nice things to try as a way to treat yourself. So let's start with the median nerve. It's that carpal tunnel nerve. It's going to come right down through the wrist here. And so when we do a nerve glide, we want to take, let's say I'm doing I'll mirror you. So my right ulnar nerve, median nerve, I'm going to take my left hand and grab right here on my right shoulder. And so just with my arm down, palm facing forward, I'm just going to extend the wrist and flex the wrist. So this would be the beginner version. So as my wrist extends, I'm tensioning, quote unquote, the nerve. And then as my wrist flexes, I'm taking the tension off. So this would be beginner, just your very first option. Now, if you don't really feel much with that, you can bring the arm out to the side, flip the palm to face up, and then as you extend the wrist, lean your head towards. As you flex the wrist, lean your head away. And so what this is doing is it's just allowing that nerve to glide, and we're moving it from above and below. So up at the neck and down at the wrist. So getting that full length of glide. All right, so that's median nerve, easy enough. Radial nerve is going to come down the outside of the arm, your thumb side, called your radial side. And so the first beginner glide for it will be, once again, this left hand is going to give a little bit of tension. That's just going to keep that nerve kind of set down, and it's not going to let your shoulder hike up and affect it in any way. This time our palm will face back, and we'll just flex and extend the wrist here. This will be your first beginner glide. And if you're not really feeling much with that, then you can add the head, leaning away, or leaning towards, as you flex, and leaning away as you extend. And so now we're mobilizing from above and below. And so we're always leaning the head towards as we tension from below, because we don't want to be pulling on both ends. If we did this, that's pulling on both ends and really getting a stretch. We're just gliding. So we lean away and here. And then finally, our ulnar nerve, which is our funny bone, which comes down the inside of the arm or the ulnar side of the forearm. And so the beginner for this is just going to be to bring the arm up. Once again, we have this left arm holding, palm facing towards the face, and just flex and extend the wrist here. So this would be your beginner option. And then once again, if you want a bit more, or the next more advanced would be to lean your head towards as the palm goes away, lean away as the palm comes to face down. So once again, just gliding that nerve without stretching it. It's a great way to get blood flowing to these structures. It can really be a game changer if you are struggling with any type of numbness, tingling, nerve type of pain, burning. Give these a try and see if they don't help. You can always check the LYT Daily, where we have a lot of videos. Say your wrist's bothering you, we have modified wrist videos. We have a lot for shoulder girdle strengthening, cervical spine, so you can try those out too. Anyway, thank you so much for joining me.